Everybody, I am Bev with Remax here in Sarnia, and tonight we are so excited. We've got an awesome guest that I can't wait for you to meet. But first off, I want to introduce my co-host, my sidekick. Take it away.
Hey, my name is Tracy Donald, and I am an agent with a company called Secret Direct, which is a wellness company. And we are so excited to be doing this live with all of you tonight. And Bev and I have promised to come at you with lots of local businesses, and we are excited to be doing that on Friday. But we thought how perfect to start with Julia, because Julia is the Chief of Communications and Public Affairs with Bluewater Health. And, you know, she can bring a lot of clarity to this time of uncertainty for us in the community where COVID-19 is concerned. And so we are just so honored to have you with us, Julia. And we just want to thank you for your time.
Oh, you're so welcome. You're so welcome. Forgive the bags. It's been a long 26 days.
I bet.
Yeah, that's all good.
A few questions that Tracy and I kind of were talking about and wanted to ask that we're thinking our listeners might want to know. So our first question is the one that I'm sure everybody is wanting to know is, how are things actually at the hospital?
Thanks so much for asking. So, you know, it's interesting times. It's not at all business as normal. We've reduced, normally we have around 300 beds, and normally we run at about 100% capacity, which means we have about 300 patients. And when we had the advantage of seeing, if you will, the tsunami of COVID really running through other countries, we had the advantage of saying, okay, hold on, this is coming our way. We don't know when, we don't know how, but it's coming our way. So we had the advantage of really working with a lot of our partners and actually starting to, frankly, exit out of the hospital people who had other alternatives. And it wasn't easy. I mean, people who are in hospital, they're for a reason. Yeah. Mm-hmm. So we reduced our visitation. We reduced doing all elective surgeries. We reduced a lot of things. And frankly, it's not exactly the time you want to be in hospital unless you really need to be there. And we did that because we had to get ready for this unanticipated or unknown entity called COVID. And we didn't know if it was going to bring us 5 patients or 500 patients. Wow. And so far we opened actually a COVID unit, which is actually, obviously we never had a COVID unit. So we have a COVID unit now, and it has 40 beds. And we also have an ICU, which has always been there, obviously. So patients come to the COVID unit and either they get better enough that they can go home, or they actually decline and they require sometimes ventilation oxygenation, and they actually move into the ICU. And some pass and some go home. So it's a whole gamut, it's a whole spectrum. So it's been, I would say overall the hospital's doing quite well. This was unfortunately, after SARS, every hospital in the province went through and created a pandemic plan. So while all of us anticipated that we had to have that plan, none of us really wanted to ever actually have to enact it. So we have enacted it, and it involves stage 1, stage 2, all the way to stage 15. Just today, we announced the opportunity through the amazing partnership with Lambton College that we can actually open a field hospital in their 2 gymnasiums. And the city actually donated 150 beds and cots so that we actually have, if we ever need it way down the road, hopefully, the potential to actually have some of our healthier patients move off site to Lambton College. And that means we would actually have the capacity for 300 or 400 beds in the hospital to just be COVID. So that if you think about what that means, today we have around 30 or 40 patients. If you think about what that means long-term, that's, increasing our capacity tenfold. So the hospital overall, I would say, is doing well. Is it stressful? Yes. Do we have incredibly amazing staff? Unbelievable. When we opened the COVID unit, for example, we didn't start with 40 beds. We didn't have the need for 40 beds. We started with slightly less than that. And we thought, what do we need to do? So we put out a call and said, if you have, so COVID is a respiratory illness, as you both know, and it presents itself in breathing problems. So it makes sense that you're going to have nurses and RPNs and RNs and PSWs and people working that unit who have experience with breathing problems, right? As opposed to, let's say, diabetic care. Mm-hmm. So we actually put out a call, and we didn't have to ask anyone. We didn't have to, twist any arms. These amazing men and women raised their hands and said, like, put me in. So it's pretty humbling. I'm not a clinician. I'm not a doctor. I'm not an epidemiologist. But I have to tell you, this has been, in my 25 years of doing communications and public relations, probably the most inspirational work I've ever done in my life.
Wow. I saw a post on Facebook and it actually made me tear up. It was
Yeah.
That's actually so amazing to hear, and it actually leads into our next question, Julia, because we know that the frontline workers are doing their part, whether it be at the hospital or in the grocery stores or in the essential services. They're all doing their part. So we're all sitting at home and we're all going, how do we do our part in this? What is it that we can be doing to make this go away as absolutely quickly as possible and save as many lives as possible?
Such a great question. Right now, again, I need to look at this with a glass half full approach. I think if we don't, we're just going to go crazy. And we have the beautiful experience of understanding what happened around the world. And we know that in places where they didn't do social distancing and they didn't do proper caring of each other and caring for each other's community, what the results were. So everyone talks about flattening the curve, but I want to talk to you about why flattening the curve is important. So flattening the curve means that we try and reduce the opportunity for a big bubble. And as opposed to having a big bubble of whatever that maximum number is, let's say it's 1,000 people. I have no idea. As opposed to having 1,000 people in a 2-week period, you may still have 1,000 people, but it's going to be over a 4 to 6 week period. And the reason this is important is that it means that the testing, the personal protective equipment, and the health human resources are able to handle the capacity. If you have a large surge in any patient group in that time frame, it's actually difficult to keep up. So we've actually done a pretty good job in our community, I would say. I know there are some people who are treating the current order as social isolation. Now, social isolation is truly in place for those people who have traveled in the last 2 weeks.
Right.
There are many of us who are choosing to do social isolation. My goodness, it can tell it's the end of a long day. There are many people who are choosing to do social isolation, even though they're not required to. So my personal view, and keep in mind that I work in a busy hospital and I, work a lot of hours, as do all of my colleagues. I'm not alone in that. My personal view is that we need to really, really, really look at physical distancing. Social isolation, I'm concerned about the ultimate impact on people's mental health. So for myself, I live in the Grove and I go for a walk every night down by the lake. There's no one around. It's just me and my 6-pound dog, and we go for a walk and enjoy the night. And sometimes my husband comes, but he's already a contaminant because he lives in the same house as me. Right. So, if I have it, he has it. But I think the most important thing for people to do is to lead with science, not fear.
Yes.
We need to really remember that there are 1,000 different viewpoints and 1,000 different experts on this. And when in doubt, if your heart is in your throat, that's the moment you need to stop and be calm and lead with science, not fear. And remember that this is not anthrax. This is not an airborne disease. This is something that is, they call it droplet precaution, which means that it is like a drop. It goes out and it drops. So there are certain things that we can all do, like wash our hands, don't touch our face. I mean it quite seriously. I wash my hands easily 100 times a day, easily. My husband's a diabetic. He's at high risk of, if he was to contract this, he's at high risk of negative outcome. So for example, in our house, I won't let him do the grocery shopping. I won't let him go out to Shoppers Drug Mart and pick up the medicines or whatever needs to be done. We do all kinds of things in our backyard. We go for a walk. We stay away from everybody else. We find a trail, an empty trail that we can go on and just kind of decompress. But that's how we handle it. So, yeah.
Awesome.
Question number 3 is, I recently heard that Sarnia is a hot spot in Southwestern Ontario. Is that true? And is it something that we need to be concerned about?
It's a great question. And if you look statistically, we do seem to have, if you look at the number of confirmed cases in hospital, we do seem to have more than, Windsor or London and Chatham. And at one point last week, it was combined. We had more than those people. So statistically, it's not phenomenal. But I have to tell you, what is great is that we're able to track or through Lambton Public Health, we're able to track those people or those cases back to a specific source. What would be more worrisome is if you had, let's say, 30 or 40 cases that didn't have a common root. So right. I would say that we're not in bad shape. I have to say, I mean, the flip side of being in Sarnia-Lambton, aside from our number of cases of COVID, is obviously the Valley. And I have to tell you, I listen every day. I sit on calls around the province, people talking about personal protective equipment. It's been the topic of the day this past couple of weeks. And I have to tell you, while on one side, yes, we do have what would seem on paper slightly higher numbers, we have the Valley, who has stepped forward in a way that is completely unprecedented and unbelievable. And it is honestly the most humbling experience of my life, where we have people stepping forward and saying, we have disaster relief PPE, we have N95s, how can I help you? So on one side, people I know in Sarnia, I'm a transplant. People here are always like, oh, Sarnia. But I have to tell you, I've never, in all of my years of doing crisis communications, I've never seen a community rally the way this community has. And it is nothing short of miraculous.
I kind of said the same thing in our intro to doing these videos when Tracy and I talked last week. I'm an implant, she's a purebred, and I had said the same thing, that just the way community is here is different than anywhere I've been.
It's true.
I agree. 100%. Yeah. Okay, well, to wrap this up, you know what? We always want to leave our interviews on a really fun note. And this is going to seem a little bit silly, but just work with us. So we had you pick 3 numbers between 1 and 10. And we have a designated question list. And you picked 2, 5, and 6. 2, 5, and 6. So Bev, go ahead and ask.
So number 2, this is kind of like a rapid fire, just to throw it off. So scent, C-E-N-T, and scent, S-E-N-T. In scent, S-C-E-N-T, what's silent, the S or the C?
I'm sorry, I need you to answer.
C-E-N-T, scent, S-E-N-T, or scent, S-C-E-N-T. What's silent, the S or the C?
C.
Awesome. So then we're number 5. Our question is, in 40 years, what will people be nostalgic for?
COVID-19. No. This extended long weekend we all got. Well, I didn't, and the hospital people didn't, and healthcare workers and people working grocery stores didn't. What will we be nostalgic for? Gosh, I think we're going to be nostalgic for the good old days of that old-fashioned technology called Facebook.
Tracy was talking earlier, and I said Facebook Live.
Yes. Yeah, exactly. Selfies.
Yes, exactly.
That's a good one.
Yeah.
So number 10, and we'll end it, well, obviously here, but if there were a movie, if there were a movie made about your life, who would play you?
Julia Roberts.
I was going to say that too.
Just for the last that I'm thinking, Julia. Wonderful. Wonderful. So everybody, stay tuned with us for Friday. We're actually going to start our small business videos. We had came to you last week with our kind of idea on what we were doing, and we just thought having exposure to Julia was something that we couldn't pass up. And we just thought the reason we're doing it in this format, is because of what's happening in our environment. And we just thought it was a great way to kick it off, and we really appreciate that. But Friday, we are going to be starting our small business videos. So stay tuned. We're going to be coming to you live on Friday, and we've got some great people lined up. But if you know anybody that has a small business that could use our help with getting their name out, what they're offering right now, or maybe even just talking about what they're looking forward to when they open again.
Yeah, exactly. And so, Julia, honestly, from the bottom of our hearts, on behalf of Sarnia-Lambton, we want to thank you for bringing a little bit of a peace of mind and some clarity to this crazy situation that we're in. And someday in the future, don't know if it'll be near future or not, this is going to be behind us, and we're all going to just remember those times where we came together to try and bring light to people. And it's people like you that are doing that. So thank you to you and all of the people at Bluewater Health that are literally doing everything they can to help us through this crisis.
Stay safe.
Thanks, everyone. Have a great night.